finally, I want to just introduce Dr. Fasih Khan, who is from BIMA. Do you want to quickly shed light on the seriousness of the virus and how we can, inshallah, protect ourselves from the virus?
Sure. Assalamu alaikum to all our listeners. So I'm representing the British Islamic Medical Association, which is a non-sectarian unified body of Muslim doctors in the UK, doing a lot of grassroots level work and also higher level advocacy work as well. I think I'd begin by saying this is once in a generation, not even once in a generation, once in a century. You know, this is something that future generations will be talking about. This is something incredibly serious. And our job as healthcare professionals is not to induce and spread panic, but it's to make people aware of the reality of the situation. And as a frontline chest physician, there are significant concerns. And I think I would be doing an injustice if I held those concerns from our listeners today. So
the BIMA, I mean, you guys produced, I think, yesterday, after the BBSI and the MCB, and then you guys produced a, two-page letter to the Muslim community. What was the content? What was the main message of that letter?
Yeah. So what we felt is, if we wrote a letter expressing our feelings and sent that out independently for signatures, so there was no pressure on any individual to sign that document, then hopefully we won't be accused of any sectarianism or any political motivation. This is a significant concern that we have. So the letter was written by BIMA and it was disseminated through various channels to BIMA and non-BIMA members. That letter was then released today with almost 200 signatures. And those signatures were in a case of about 12 hours. That's incredible. And the letter essentially called for the Muslim community to take this very seriously, and for our ulama, for our masajid, to consider very strongly what activities are to continue in our masajid and madaris. But going back to your first question about the coronavirus, if you allow me a few minutes, let me explain. So the coronavirus is no different, is very different, shall I say, to any other flu or viral illness we've seen previously. The difficulties, the symptoms are the same. And patients present with breathlessness, cough, and fever, and they think, oh, this is just nothing, this is just a cold. But we know this could be coronavirus. And the second worry is you can be transmitting this illness even before you develop symptoms. And that's been demonstrated. And certainly this is a huge concern because the virus is incredibly contagious and you could be spreading it at a very early stage before you have symptoms. Now, the mortality, based on data that we have so far across the world from the World Health Organization, is showing a mortality of 3.5%, which is staggeringly high, 35 times higher than the flu. But what's really alarming and what's really concerning is that mortality in those over the age of 70 is up to about 8%, and those above the age of 80 is between 10 and 14%. That's 1 in 10 to 1 in 6 or 7 of our 80 plus population who, unfortunately, if they were to get coronavirus, would succumb to their illness. This is nothing, we've never seen anything like this before. This is unprecedented. The government's prediction is that between 60 and 80% of the population, UK population, will get coronavirus. And we've done some modeling, some very straightforward, basic mathematical modeling to try and work out the effect of this. And I would urge authors, listeners, to understand the scale, but take it with a pinch of salt, because these, not with a pinch of salt, but don't completely dismiss it at the same time. These are, basic statistics that we've used. So if we look at let's look at the Muslim community first. In the UK, we have about 2.5 million Muslims. And if we take a more conservative figure of 60%, that's 1.5 million Muslims are expected, if this goes as planned, trajectories are following Italy and other Western and other countries that have had a lot of numbers, we will have 1.5 million sufferers of coronavirus amongst the Muslim community. Of those, about 10 to 14% will be hospitalized. So we're looking at 200,000. And then we work out the mortality. And
200,000 of the Muslim community, you mean?
200,000 of the Muslim community. We just took out the Muslim community here. If we extrapolate that to the wider UK population, we're looking at 5 million hospitalizations, staggering numbers, and 50,000 deaths in the Muslim community and 1.5 million in the UK overall population. So this is serious, and I think I've made that very clear. Now, what concerns us, and I think this will set the context for the rest of your discussion, is that our communities are very different to any other community. We live in very close-knit families. We have extended families with grandparents, parents, and children living under one family. We, share a lot. We sit together at the dining table. We sit in front of the fireplace together. We're very tight-knit. And our elderly, we know, have a higher prevalence of conditions like diabetes, blood pressure, and heart disease, which has been shown to increase your risk of adverse consequences. And then we look at our masajid. We can say this is a breeding ground for the masjid, enclosed spaces, lots of people together, formite spread on carpets, people hugging, shaking hands, embracing, talking, wudu facilities, and then the elderly population going to the masajid. So I think this is a very significant problem. I think the Muslim community really need to understand that this is probably going to affect, we pray for a good outcome, inshallah, we pray for no deaths. However, the reality is that currently as things stand, the Muslim community will unfortunately be disproportionately affected. And I think our community leaders and everybody needs to understand that, so we can put in the mechanisms in place now to prevent that and look back and think, why didn't we do this, or we should have done this.
Can I just come in there? I think, and I'd like to thank Dr. Fasih for that. This is a message that we need to ensure is disseminated. As Mufti Amjad has said, the people that really need to hear this are not going to be tuning into this Facebook Live webinar. It needs to be very clearly explained in language that they understand, in using a means that they understand, and taking into consideration what their concerns were and what their concerns are. But I just want to thank Dr. Fasih for being very, very clear about this, and just to summarize, the points here, that this is not the flu. It is different from the flu. I work in the NHS, and I've spent the whole day today, and I'm in a mental health trust. I'm not even in an acute trust. In a mental health trust, basically talking about locking down the hospital, basically talking about cancelling everything that is not urgent, the patients who are not absolutely in crisis. This is being taken very, very seriously by the NHS and by those who are most aware of the harm that this can do. And I would really urge those of you who are watching and listening along here to ensure that you do your bit to inform people about the potentially serious consequences. And also, as Dr. Fasih said, that given the combination of factors, the Muslim community are likely to be particularly affected by this coronavirus.